Hey, hello again everybody. This is Dr. Rob Lindsay at Vallejo Health and Wellness Center, and today I want to talk about the root cause of the day, and it is related to something called Candida. So Candida is yeast, and we all have it. It's part of our normal microbiome, which is the balance of the different kinds of bacteria and yeasts that we have in our body, within our gut, within our mucous membranes. They're part of our immune system, and the thing is with these yeasts, typically, or what's normal, is that they should be in balance with all the different kinds of bacterial species. And if one of those gets out of balance, whether it's yeast, the Candida, or it's bacteria, we can develop symptoms. And guess what? The symptoms don't have to happen just in the gut. So here's a case in point where a gentleman in his 50s who came in, and his presenting complaints were that his fingers and toes were numb, and then during the cold months they would begin to sting profusely, like he had ice picks in him. He also had really unexplained itchy skin. He couldn't figure it out. He had been to lots of doctors, and as we began to test him using our functional toxicology testing, we found that he had Candida infection systemically, in particular in his capillaries. Well, capillaries are the smallest blood vessels that we have. They are part of our cardiovascular system, so they carry blood to the fingers, for example. Well, guess what? If you've got Candida in your capillary system, it is going to interfere with blood flow to that area. And when you have decreased blood flow to an area, which carries oxygen to that tissue, in this case, say the fingertips, well, it's going to be numb. It's not going to work good, and it might get really stingy if it's exposed to cold. Also, his itchy skin, I think, is related to the Candida I found within his lymphatic system. So the lymph system, you've heard of lymph nodes. You know, if you have an infection, a lot of times the doctor says, yeah, your glands are swollen. Well, guess what? You don't just have glands right here, lymph nodes here. They're everywhere throughout the body. And between every lymph node is a vessel called a lymph vessel. And the lymph carries a fluid. And within that fluid are immune cells. Cells that help to fight infection and help to clean up the debris left from the breakdown of tissues, the breakdown of bacteria, breakdown of toxins. So your lymph system is very important as it's part of your immune system. So in this case, this man had had tons of antibiotics earlier in his life because of chronic nasal and sinus infections, to the point where they actually had to do a sinus surgery to try to clear out the infections. But every time he'd get an infection, he would get more antibiotics, more antibiotics. Antibiotics actually kill the good bacteria as well as the unwanted bacteria, which then allows the yeast, the Candida, to flourish and grow and get out of balance. So when the Candida gets out of balance, you can experience symptoms. For some people it's within the GI system, but for others it's in other weird, seemingly unrelated places like the capillaries or like the lymph system. So he's getting itchy skin, which wouldn't go away with the potions and lotions, and cold hands and cold feet, which wasn't being addressed at all because the doctors couldn't find anything. So the point is that if you want to get to the root cause of your issues, you have to have the right testing done, and I think that we have the ability to do that here. So now we can begin a treatment program that will help to remove the excess unwanted Candida, help to bring back into balance that microbiome within his body, and his blood flow, I believe, is going to increase, and therefore his fingertips are going to clear, and his itchy skin is going to clear as well. That's my hope. I think that's what we're going to see happen over time. And remember, get to the root cause. All right, we'll talk to you another time.